Welcome, everyone. We'll get started in 1 minute. All right, welcome everyone to our live presentation. It's National Public Health Week 2022. I hope you all are having a great week so far. My name is Gilbert Arvizu. I'm an MS student at Johns Hopkins University, Carey Business School. I'm also an associate at the U-Arizona Zuckerman College of Public Health, Division of Public Health Practice and Translational Research, and I'm your CHPPD student liaison. Today's theme, April 5th, is around the public health workforce, and I am glad that you are joining us today for this very important topic. With that, I will kick it over to our presenter, Vina.
Thanks, Gilbert. Hi, everybody. My name's Vina. I am currently graduating senior at Johns Hopkins University, where I'm studying public health and social policy. And in the fall, I'm very excited to start my MSPH in International Health Systems. I'm really excited to meet you all. I'd love if you're able to drop in the chat, if you could introduce yourself and where you're joining us from. That would be so fantastic as I'm getting my slides together. Okay, here we go. I think. And could I get a thumbs up if you can see the slides in presenter mode? Okay, great. Thank you so much. So without further ado, I'm going to dive right into this quick presentation on the quick hits to quantifying the challenges facing the public health workforce. And I want to focus on this topic because I think all of us in this section understand the importance and the essentialness of the public health workforce, whether it is interfacing directly with communities or focusing legislation and putting health in alt policy. We recognize that public health, where it stands now and where it's going to continue to grow, is important for the health of our communities, countries, and world as a whole. However, as we've seen through the COVID-19 pandemic, there have been a number of instances where the public health workforce has been under threat. I want to provide some quick hits today and specifically focus on quantifying the challenges that face the public health workforce through these quick, really impactful statistics. And then I also want us to think about very early on how we can use this knowledge and information and turn them into calls to action, whether it be for reaching out to your employers or your staff and instituting local policies in your workplace, directing research or energy towards understanding these challenges and ways that we can address them through wellness, or affecting policy and legislation. Even at the local level, instituting policies can help protect the public health workforce, and we'll talk about that in just a second. And last but not least, exposure for students. Gilbert, myself, and I'm sure other folks in the call who are students as well, recognize that as students entering the public health workforce, whether as a practitioner or working in academia, there are a lot of challenges and obstacles that we have to overcome. And so what skill sets and knowledge can we bring into the workforce to help support the current workforce and our future peers? Just by a raise of hands or thumbs ups, how many individuals here are students? So I can feel out all the people who are my peers. Okay, I see 2, awesome. And then how many people are public health practitioners working at a health department, at some level of government in public health? Awesome. Thank you, Sarah, for all the work you've done. We couldn't do this public health work without you. And last but not least, how many folks here are from academia, working in an institution or a think tank, consulting group? Gotcha, none from academia today. But we're gonna dive right in anyhow. So the first thing I wanna do, as any good scientists would do, is give us a breakdown or understanding of the public health workforce, shortened to PHW, that exists today, so we can get an idea of what the average workforce looks like. So as of 2014, and this number may have changed, especially with the recent loss of public health workforce during the COVID-19 pandemic, there's an estimated approximately 290,000 public health staff in the United States. And a majority of that staff, 50% of which, work at local public health departments at the front lines of developing either programs, interfacing with communities, and the rest work at the state and federal level. In terms of the types of skills, a majority of staff work in admin or clerical fields, majority being just 20% of the most, followed by nurses and people working in environmental health, managers, and lab workers, which obviously have been working very hard, especially considering the need for testing and such. I also want to talk about the breakdown of the workforce as it relates to gender, race, and ethnicity. Interestingly, or perhaps not interestingly enough, in terms of gender in the public health workforce, if we take a very binary view, as we have from this research in 2017, we see that at the state and local level, at least, a large majority of public health practitioners, of 80%, are female, with a smaller percentage being male. And this proportion is actually higher than the average among state and local government workers overall. In terms of race and ethnicity, what I find most interesting is that, or perhaps not most interesting, is that a majority of staff who work in public health are white, and this mirrors the percentage working in government staff overall, followed by Black and African American at a much smaller percentage, followed by Hispanic and Latino communities, Asian, American Indian, Alaska Native, so on and so forth. And if you take a look at a quick snapshot of my awful table here from the US Census, we see that the proportions match up pretty well, with the majority coming from white communities, but a flip-flop in individuals coming from African American, Black communities, and Hispanic communities. Now that we have this overall idea understanding of what the public health workforce kind of looks like, I want to talk about three main challenges that the workforce is facing and why they're under threat. Specifically talking about huge rates of mental health and facing severe mental health conditions, burnout, and workplace harassment. So first, in discussing mental health conditions, I believe all of us understand and recognize the importance of talking about mental health in our youth. But what I find most interesting is just how pervasive adverse mental health conditions are within the public health workforce. A recent survey that was actually also published in the CDC's MMWR by Bryant Genevieve et al. The survey was conducted across a representative sample of public health departments across the United States, surveying over 26,000 people. And they found a number of mental health concerns that were brought up, including depression, anxiety, PTSD, and suicidal ideation. In fact, they found that 52%, keep in mind, this translates to 1 of every 2 public health staff members report at least one mental health condition. And of these 26,000 respondents, a third cited experiencing depression, a third cited experiencing anxiety, and another third cited experiencing PTSD. And obviously there's going to be some overlap and comorbidity with that too. What I find most impactful, and as a statistic I hope that you're able to take away from today, is that 8% of individuals cited experiencing suicidal ideation in the past 2 weeks of taking the survey. To compare it to some sort of baseline, SAMHSA estimates that among adults in the United States nationwide, 4% experience suicidal ideation. So this rate in the public health workforce is double, which is a huge burden on our public health workforce and their health and well-being. A lot of this can be attributed to burnout and workplace harassment. When it comes to talking about burnout, the same study found that approximately 60% of workers worked over 41 hours beginning March 2020. And as we all well know, with often limited resources and funding to compensate them for that time. Additionally, a quarter of respondents were actually afraid to take time off of work during this period, 2/3 of which cited feeling guilty about leaving, and another 6 out of 10 reporting feeling guilty about leaving. One thing we don't talk often enough, in my opinion, is caring for the carers. Many of us in public health, and especially public health practitioners on the front lines delivering services, are often sacrificing their health, well-being, time spent with family to support their communities. We've also expected a number of things from our public health departments: increased access to programs, higher quality, ensuring equity, increased communications, public health facing press releases, and the list goes on and on. However, the amount of funding they receive has gotten smaller and smaller. In fact, the amount of funding that public health departments have received has been cut in half in the past decade. So what do you have when you have increasing responsibilities, but the lack of resources and capacity to address them? Burnout, which then turns into high rates of turnover, lack of retention, and poor well-being and capacity within the public health workforce. A part of this, we can see an article out of the New York Times cited that over 500 health department leaders, people who are either chief health officers or department directors, have left their positions since the start of the pandemic. And a lot of this can be cited towards workplace harassment, violence, and threats against the public health workforce. I would actually like to take this time to show a short video, a very visceral one, showing just how impactful and the threats received by public health practitioners. But I understand it's also very difficult to watch. So if you would like to, or you'd like to take this time to step away from your laptop if you need to, the video lasts for about 2 short minutes. Give me one second.
I just want to remind you, if you can share the sound of your video. I don't know if you know how to do that.
Absolutely. Thanks for the reminder. Gilbert, if you could give me a thumbs up if you do hear it. So here's the video, and this video is a compilation of various public hearings held at local cities across the country. I'm sure many of us may have seen this in social media and the news, but I think it deserves a second look in this compilation. So now I'm going to start the video.
Doctors are going to be arrested for crimes against humanity.
The governing body should fear the people. We are pissed off.
Dr. Berry, we're coming for you.
Quit abusing our kids!
We will not bow down to communism. We will not allow this regime to continue.
And I will not be muzzled like a mad dog.
We will be outside your houses with megaphones. You will not get sleep. We are not giving up any rights.
My 12-year-old son is home by himself right now, and there are protesters banging outside the door.
Do you think that the 4 feet of marble that holds you above high in this chamber will help you from the fate of humanity which you are unleashing? No! It won't!
I can get in if I want, I promise you. This is not your building. This is not your building. No, 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 no. We will not be pushed locked out.
You, the evil, the wicked, will be dethroned.
Put our public servants on notice that we will not now, nor ever again, allow our inalienable rights and constitutionally protected liberties be taken from us. We will give no more ground. We will not comply.
And for you to propose vaccines for children is genocide.
Hey. Wrong. You all know it. I told you.
And I'm not doing it to threaten anybody, but there's a lot of good guys out there ready to do bad things soon. Watch what's coming.
All right. I always am very affected by this video, hearing especially the one public health staff member who shared that her child was at home and worried for his safety. It's something I think about a lot. And research has shown that these incidences aren't isolated and have been found across the country. A study out of Johns Hopkins Bloomberg School of Public Health found that in the short time period between March 2020 and January 2021, which is about 8 months or like 330-ish days or so, there were 1,500 reported incidences of harassment. To put that into perspective, that's 4.5 harassment experiences per day. 4.5 per day during this time period. And it wasn't isolated to specific departments. In fact, of the sample of the health departments across the United States, 6 out of 10, so more than half, reported having at least one harassment experience during this time period. Beyond just the confrontational experiences, a lot of staff members, a quarter of whom reported facing stigma because of their work, whether it be in their communities or even in their family settings. Additionally, over a tenth, or 1 out of 10 individuals reported facing job-related threats, whether it's against them or bodily harm or losing their jobs. And if you're interested in reading more about that research, you can find it here on AJPH. So considering the high number of these workplace harassment incidences, you would think that there would be protections in place to protect the public health workforce and provide some sort of consequence to alleging these threats against public officials. However, there still remains a number of states that don't have these protections in place, and they're listed here. They include Alaska, Connecticut, Massachusetts, and my state as well, Maryland. In fact, our office was very closely watching a piece of legislation going through the Maryland legislature that aimed to include public health officials underneath an umbrella mandate protecting public officials from harassment and introducing fines for individuals who do any sort of harassment. It was really unfortunate. Last week we were tracking the bill. It got passed in the Senate and sent to the governor's desk. However, unfortunately, the clause that would have included public health officials was crossed out in the final version. What remained were state's attorneys, district's attorneys, and only the chief health officer, but none of their staff. I want to circle back to this in our discussion. We talk about the call to action and talking about legislation. This is one area in particular where we could do a lot of energy and work around protecting staff and putting policies in place that that maintain that protection through legal means. And that takes me to the end of these quick hits, but the conversation is not done. The next question becomes, what's next? And I want to open this question up to the floor and to the folks on our call today. Does anybody have any initial thoughts about what are ways, building off of these really incredible but very awful statistics, how we can work to support and protect the public health workforce? It's a hard question to answer. While folks are letting that stew and think, I'd love for if you would drop it in the chat or feel free to unmute yourself and speak. Here are some thoughts in my personal perspective as a student, a young person new to the field as well, of 3 areas that I believe we could really focus on supporting the public health workforce. The first is through trainings. Training our staff, although they already have a number of trainings to go through, to manage the politics and the stickiness of public health mandates, especially issues that we've seen come to the forefront with COVID-19. A paper I really like to read that's been really interesting to me is called Politics and Public Health, Engaging the Third Rail by Edward Hunter, talking about how we often in academia or even in public health, we're so focused on the facts, figures, and evidence and stray so far away from the politics, we often neglect to realize that the two are very intertwined. You can't forward public health policy without engaging with the politics of it all. The second thing I often think about, and I think is important, as I mentioned before, is protections against harassment. There need to be legal protections to ensure that there's some sort of repercussion, a deterrent for people to realize that they can't harass and threaten bodily harm, other types of harm against the workforce and their families. Additionally, while that may be difficult to pass, as we saw in my state of Maryland, there can also be institutional policies. I'm about to show a document and drop a link in the chat to a very clear call to action of how you can speak to your employer and your staff about instituting policies to let people know that there are protections in place if they face workplace harassment. Last, but certainly not least, I speak to my students on the call, and I hope that you can chime in here too and let me know what you think. I think one thing we can bring to the public health workforce while we're still in school is working hard to diversify our skill sets. Not only, I found myself doing this often, pigeonholing ourselves into our research and our analyses, our STATA and R programming languages, but also building in those communication skills, understanding the politics, the political economy behind public health, so we can bring those skill sets into the workforce when we begin to become practitioners. Additionally, actively engaging and keeping track of legislative discourse so that we can respond, advocate for bills that are important for public health goals. And last but not least, supporting the translation of research into policy, much like Gilbert does in his work as well, taking this valuable, enriching research and knowledge and putting it into practice so that our communities can benefit are things that I think about often. And with that, that takes me to the end of my presentation today. Thank you all so much for your time. I'd so love to hear your questions and also points for discussion.
Thank you so much, Vina. I would like to talk about this slide in particular, the diversity of skill sets. I really think it's important. And so an example from my lived experience is I received my bachelor's in public health, and I went the business school route instead of the public health route because I knew that I was going to need to make those business cases, those arguments in funding public health programs or developing new types of programs or whatever the context is. And I appreciate that you put that there because it is very necessary to diversify our skill sets because again, in my example, in order to hire the folks that we need to get the work done, you have to go and make that business case to the hospital leadership or the head of your public health department, whatever it is. And so I'm glad that you touched on that in your presentation.
I appreciate that, Gilbert. I think your route is really unique and impactful because we definitely need more folks who are willing to engage in that diversification. Absolutely. And Pooja Dinesh asked a great question. Is it possible to lose your job in the medical field due to people's backlash? Well, I don't know about the medical field. I can speak in terms of public health officers. A professor of mine who became a chief health officer in a neighboring county actually got ousted from his position without notice, without recourse, because of a vocal minority in his county that was advocating against mask mandates. Due to their advocacy at public hearings, at city council meetings, they were actually able to convince the city council to remove him as a chief health officer without any notice. And so it is most definitely possible. Whether you're forced to leave or you leave to protect your wellness, a lot of individuals in public health, and I'm sure in the medical field too, are facing backlash. This goes back to why we need those protections, to ensure that when people do face this backlash, there are support systems in place to ensure that they have some sort of resources when experiencing those. That's a great question.
So I'm Pooja still. You said that if for the public health officials, whether you take a leave of to take yourself, make sure you're well enough to go back, would you still lose your job then if something popped up?
I'm actually not too sure. I think that's where my knowledge and expertise ends. Does anyone else in the call have thoughts about this at all?
I mean, I think the example you gave, Vina, is an example of where, you know, the community can advocate to their elected officials to get someone removed. You know, in the medical field, folks can file complaints with the board of, you know, whatever state, however your state runs its board that oversees, you know, clinical practitioners. They can submit complaints and even speak, publicly comment at those board meetings. So I think there are, to your question, Pooja, there are ways that community members can voice their opinion and have influence on your job, particularly if it's a public job or a public servant job.
Thanks, Gilbert, for chiming in there too. I want to highlight what Steffi Annis, am I pronouncing that correctly? Put into the chat here, talking about how do you balance this point of neutrality, but also engaging with the politics of public health. I just want to read it very quickly, so I think you have some really great sound bites here. Steffi says, I really believe that public health professionals need to be more well-versed in politics and how it affects us all, rather than moving away from it in an attempt to appear neutral in some way. Neutrality, as we know, can often be both complicit and may even make us seem as an ivory tower detached from the rest of society. And Kate also seconds this as well. That is a great point. I think it's something that we learn in communication as well, which is talking about how we have the science, the facts, and the knowledge to back up whatever policies we want to put in place. I think HIAP, or Health in All Policy, has great structures and frameworks in place to talk about how the politics and health overlap and entwine with each other. And I think that's something that we struggle with a lot. The former UNHCR High Commissioner often called upon academics to be advocates as well. And I think it's something I struggle with too. I think we could do more. And I think it's just like the knowledge and practice in doing those types of things and in educating ourselves into the politics behind, whether it's legislature or city council, would be really impactful too. Do you have any thoughts about how you think politics and public health, how we could do better to learn more about both? In any case, I know that's also a big question to answer too. And I know that, as you mentioned, you don't have access to mic. If anyone has, oh, go ahead, Pooja.
I feel like politics in general is such a hard topic for anyone to really discuss upon, because there are going to be people out there who are going to quote on what you say and, you know, switch it around. And it's kind of annoying because I know, in like experience wise, when I was getting a presentation and it started getting political in school, it was kind of hard to answer back to the people because they had all these weird facts and some of them weren't true, but people were always believing them and everything like that. But I feel like, yeah, the training to have your staff be more like well versed with the political might help.
That's a great point, Pooja. And thanks for sharing that personal piece too, especially when you bring politics and like how it affects our personal networks as well. It's a whole nother discussion. As we're wrapping up, I know that we're at 3:30 and at time. I want to leave you all with a quick kind of another fast facts flyer that you can share with your networks as well about how we can stand with public health and work and address workplace violence in public health. I don't have time to go through its entire call to action, but I think it's a great read if you have the time. And if you have any future questions, please feel free to email me. My email address, I'm going to drop that in the chat as well, is always available to you. I'd love to discuss more and learn from you on your thoughts about the topic. And Gilbert has already also shared my LinkedIn, and you're welcome to connect with me there too. Thank you everyone today for your time.
Thank you so much, Vina. We really appreciate it. I want to echo some of the comments in the chat about congrats on graduating. Good luck on your graduate studies. And we thank you all for attending and watching this video about the public health workforce sponsored by the CHPPD Student Committee. Thank you all. Have a great rest of your National Public Health Week.